Good afternoon, everybody. This is our mic check. If you can see us, if you can hear us, give us a thumbs up so that we'll know everything is working properly. We will start at 3 o'clock. Good afternoon, everybody. This is our mic check.
Good afternoon, everyone. I hope everyone's having a good day today. It looks like it's pretty outside, a little windy, but we got some rain coming, possibly some storms this evening. But I'll go ahead with my update here on our talking points. We have, of course, the election that happened yesterday. Appreciate everyone getting out and voting yesterday. And the big thing, that I was really worried about was the splosh, and it did pass by great numbers. And we really appreciate the government authority appreciates that, and I'll tell you that's the biggest thing that could happen to the county, or most positive thing right there is because it would have been devastating if it had failed, and it's just something that I'm just so thankful that's it's good for another 5 years, so that is a good thing, and just it was a really good turnout, and the weather was a little bit bad, but I'm just glad everybody that did vote got out and voted. So. And hopefully the person that you voted for won, and if not, we'll maybe next time. But anyway, the had a call about an issue up on Dugan Loop, and we're handling that today. I don't know whether had more than one call about it, about evidently some construction or something up there where they've torn the road up. Billy's up there looking at that right now, and to see what's going on. And actually, I understood from one of the people that called me, said they'd already closed the bridge there on Dugan Loop, and it's the only way out would be go back around. But he's up there looking at that. We've not got notified, Kerry Wright, that they'd closed that bridge yet.
We have not.
So anyway, we'll give you an update on that tomorrow. What's going on there? Nursing home, mentioned that yesterday and the day before. It's great. Everything's good out there. They're doing a real good job out there. There's no COVID-19 at all there, so thank goodness for that. And I want to mention also this Friday is the last day, July 12th. That's the last day of your stay-at-home order issued by our governor, state of Georgia, and so that's great. That means you senior citizens, you can go back to as normal as you feel like you need to. That doesn't mean you can go out, and I would still use really good judgment, especially. Not only if you are elderly or senior citizen, or if you have any kind of problems, with your lungs or whatever, still be precautious. That don't mean to go out and just, you're not going to go back really to normality, but you still need to wear those masks and be cautious when you're at church or when you're buying groceries or whatever. So, but still though, that order is lifted. So just go out and enjoy yourself the best that you can. The testing downstairs, we had a public Board of Health meeting today. We had to do it by Zoom online, Alex and I, we attended, and well, all the board members were there online with us. But the question was asked about the testing in the state of Georgia. Was asked to our Director of Public Health in our Northwest Georgia region exactly, the testing as far as what he expected and what the government or the governor expects as far as the people that need testing. And he said that really the objective is to have every person in the state tested, hopefully, which that probably won't happen because it's not, of course, it's not mandatory at all. But they really feel that they feel the need to actually have those results and those statistics on paper to kind of look at. And so he didn't give me a real, well, he shared some numbers there, but as far as knowing to date, how many tests that have been done, I'm not sure. I'm sure there's been several thousand. But what I'm getting at is, it's no cost to it whatsoever. It takes very little of your time. We're open 5 days a week down here. Tammy and them doing a really good job. There's not a lot of waiting time there. You can pull in. Don't even have to get out of your car. So, if you just think about it, there's no pain to it. So it'd be a good idea just to know. I mean, just to get it. If you've got anything like that on your mind that you might be just thinking about, just do it. I mean, because you can carry this COVID-19 and really not even show symptoms. And so it would really be good, to know, or in my mind, that's why we had this whole floor tested, and why I was tested, of course, the commissioner's been tested, just to know, because we do come in contact with a lot of people. And if you think in your everyday, day-to-day routine, how many people that you actually can and do come in contact to, you might even think about owing it to them just to, for you to know, just for that safety. But anyway, the Saturday testing here in Dade County, they're not doing that anymore because they was not having anyone show up at all. But you can still be tested on Saturday at the health department over in Lafayette. And if you need that number, you can call our number here at 706-657-4213. And they can give you the information. Or we've got the direct number over there, and it's a 706 number, but it's 375-7705. And they're also doing in Walker County the 5-day testing, but they're doing it on Saturday also. So also Lawson Medical here on the square here, they're doing the blood draw, to do the and that right there does have a cost to it of $25 plus the lab fee. And the one in Lafayette, the Ready Clinic, it actually charges a flat $40, and it's over by Walmart. Excuse me. It's over by Walmart, and they have a flat fee of $40 there. And both of them, the turnaround time is about 3 to 5 days as far as getting a report back. The health department, they will give you a call after the 3rd, 4th day, and they will let you know. And it's all private, no one knows about it, except you and of course the health department. I do want to mention again the disaster assistance, from SBA. That's coming from our partners in Tennessee. This is posted online. Here has it down. And they have an 800 number there you can call, 1-800-659-2955. And I also have an email address there. But Carrie's got all that on there, and you've got till the 20th, which is going to be coming up pretty quick. It's not really a hard form to fill out. So if you've had any damage whatsoever, due to those tornadoes that we had and the wind damage back a few weeks ago, then you need to get on here and try to get in line to see if they might be able to have some federal assistance for you. I'll go into our numbers. Dade County, we did stay the same from 24 hours ago. We have 41 this time. We have 1 deceased in those numbers, 11 antibodies. And in reality, if you deduct the numbers that need to come off this, we've got roughly 12 active cases out of those numbers. Carrie done the numbers, so if they're not accurate, we'll blame it on her. But Walker County, they went from 195 to 203. They have 44 antibody tests to come off that. Catoosa County stayed the same at 164 with 23 antibody tests. Chattooga County, they went from 25 to 27. They have 2 antibody tests. Whitfield County, they went from 504 to 509. Gordon County, they went from 203 to 209. Floyd County, 326 to 335. Bartow County, 523 to 527. And there's still 1,291 unknown counties, unknown addresses that haven't been tied to counties. Moving to Tennessee, they have 27,000 right now, 575 confirmed cases. That's compared to 53,249 confirmed cases in Georgia. Pretty big difference. They also have 18,013 recoveries out of that number. So that's pretty good, when you subtract that. We do not have recovery numbers, of course, from Georgia. But moving to Hamilton County, though, in Tennessee, one of our close neighbors, they went from 1,042 confirmed cases as of yesterday to 1,122 today. That's a pretty big increase. But they also have 415 recoveries that you can deduct from that, and they have 19 people that have died so far in Hamilton County from COVID. Marion County, they stayed the same at 45, but they have 35 recoveries you can take away from that, and that's a pretty good number. They have 1 deceased. Grundy County, they stayed the same at 32. They have 27 recoveries with 1 deceased. Sequatchie County, they have 21. They stayed the same, and they have 17 recoveries there. Midge County, they stayed the same at 27, and they have 22 recoveries from that. Bradley County went from 219 to 233. They have 144 recoveries there that you can take away from those numbers, and with 2 deceased. Total deaths in Tennessee, they have 435 deaths since the beginning. That's up from 421 as of yesterday. And going back up to Georgia, just to compare that, we're at 2,285 deaths in Georgia. And that's up from 2,208 yesterday. So that's kind of, those numbers are not real good. But moving to Alabama, they have a total now of 21,071 confirmed cases throughout the state. They actually stayed the same. They didn't increase from yesterday. But Jackson County,
I'm sorry,
they did. You got it.
I did. That's the new number.
That's the new number. Okay, 21,071. Okay, all right. So that is the number today. Jackson County, they went from 97 to 101. DeKalb County, they went from 276 to 278. So there's their numbers, and they're not going down any. I mean, it's kind of leveled off a little bit in Georgia here in northwest Georgia anyway. But we'll just keep an eye on them and keep you informed. I did mention, that Friday is the last day of the governor's order as far as the stay at home, and we've mentioned this several times. We'll be our 3 o'clock report. We'll start doing this on Thursday, every Thursday, every week, and we'll not only talk about the COVID-19, but it'll be any other points of interest in the county that's going on from any department. It could be sheriff's department, road department, assessors, whatever, And so we just want it to be a Thursday of information, for you. And of course, if anything comes up, anything major, like I've said before, we can come in and we can start this all over, and we can start doing this again if we have, anything that happens on up toward the fall or anything. So just keep in mind that we're here for you. All the commissioners are, and we appreciate you tuning in, and hope it helps you understand a little bit about what's going on in the county. You got anything you want to mention on the?
Someone asked a question. If Dade County has a surge of COVID-19, if there's a surge in COVID-19 numbers,
yes.
Will we get an update after Friday?
If there's a surge, you'll if it's at 10 o'clock at night or whatever, we'll come back on. She'll put this thing out. We'll get back online immediately, and if we have like a major surge or anything changes, not just on COVID-19, but anything that we have anything happens that really, the people need to be informed about. That's the good thing about this. We can come on immediately, and we can advise you. So.
And if they miss it, they can watch it on our YouTube channel.
Oh yeah, too. It rolls on the YouTube channel, And of course, Evan, I think he's still broadcasting it throughout the day. Maybe, yeah. Okay. All right. And again, if you have questions, if you hear anything going on, if you need this cell number is easy to remember. It's 423-667-8999, and it's online. This is directly to me. And if you got any questions or anything that you're not sure about, just call. Call or my emails on there too, or get a hold of Carrie there. And she can always give you an answer or get you an answer. So, but appreciate everyone. Any more questions? Okay, and we'll be back tomorrow around 3 o'clock. Okay, thank you.